just a few months on the job, RFK Jr. has pushed out the CDC director, gutted vaccine programs, frozen billions in research, and sidelined the agency during the biggest measles outbreak in decades. Public health experts, including 9 former CDC directors, are sounding the alarm, saying decades of scientific progress are being dismantled in real time. But Trump loves it. He's out there bragging and treating this like political trophy, even as scientists warn Americans that they are less prepared, or we are less prepared for the next health crisis.
People will die. People have already died. But this, the last week, the development about not being able to get the COVID vaccine unless you have a prescription, even if you have comorbidities, and that CVS and Walgreens are saying that they can't offer it right now because of the quote unquote regulatory environment. That's how people end up dying. And this isn't because I think that COVID-19, for those of us who are lucky enough to be healthy young adults, was the end of the world. It's because there are people like Eric Erickson, who's a conservative commentator, posted about this. He said, my wife has stage 4 lung cancer and she can't get the COVID vaccine now. She needs that in order to stay alive. And she's been fighting this since 2016. So, there are so many aspects to it. What the world of RFK Jr. is broad, right? It's everything from pesticides to water standards to, brain worms and whatever else is going on. But it does feel like this fight over vaccines is really what is at least ringing the alarm bells the loudest. And maybe a controversial position on this, but I saw, Donald Trump posted yesterday on Truth Social about Operation Warp Speed. He posted about Operation Warp Speed, and he said, we need more clarity about it. I want Pfizer. I've seen numbers on this, but I want the numbers to be made public, because if it really was as brilliant as people said, then I want that to be out there. If it wasn't, then I want that to be out there as well. And RFK Jr. saying, yes, this is the right way. We need the transparency. And the truth is, all the numbers have been published. You can't get all of these trials done. You can't be written up in every single important medical journal unless the numbers have been made public. But to me, it kind of signaled a little bit of a fracturing in the alliance that Donald Trump was essentially saying there is a chance, and it's a very large chance, the majority of his supporters or the sane ones think this, that Operation Warp Speed was the crown jewel of the first Trump administration, the speed at which we were able to get this vaccine done. And so I saw that as a little bit of fraying, I guess, there. And I hope that, he's just hit with a ton of data and it all gets out there and it can at least silence some of these critics, right? He hasn't even had a full year in office and we're already looking at the gutting of the CDC, like that letter from the 9 former CDC directors. And I wanted to get your take on this because there was a lot of really important stuff that they said. But what really stuck out to me is that they noted they didn't always agree with their leaders, but they never gave us a reason to doubt that they would rely on data-driven insights for our protection and that they would support public health workers. And that is the theme across the administration. The data doesn't matter. If we don't like it, we fire the person, like the head of the Bureau of Labor and Statistics. They don't like listening to the data on tariffs, on immigration, on the jobs number, now on healthcare outcomes.
In terms of real despair in people's life, real grief that was unnecessary. It could be the tens of thousands, the hundreds of thousands, or perhaps the millions of deaths and amputations that will come from a discrediting of science. Because to assemble the type of excellence in scientists that the CDC and the National Institutes for Health, our crown jewels, have assembled over decades, these people, instead of going to work for Pfizer and making $500,000 to $2 million a year in stock options, go to work for the government at $200,000 a year because they want to make a difference. They want to figure out a way such that measles stays eradicated. And just some data here. If you were to ask thoughtful people, experts, and I do think that expertise is a thing and it matters, what have been the greatest innovations over the last 100 years? I think most people would immediately, because we're so obsessed with technology, go to GPS or go to DARPA or the internet or something like that. I think that it would probably right up there, if not number one, would be vaccines. So just some data. So smallpox, which was around for about 3,000 years, in 1980 they said it was officially eradicated. Like we did away with it. Polio. My first day at Morgan Stanley, they assigned me an assistant, and we're walking upstairs. I said, "Hi, how are you?" And she had a bit of a limp. And I said, "Oh, what happened?" Assuming it was like, stupid white guy, like she did it playing in some softball league or something. And she said, "I have polio." And that's not a great way to kick off your first conversation with
Not
your assistant.
ideal.
Anyways, it only got worse for me at Morgan Stanley from that point forward. Anyways, polio cases have decreased 99%. Measles, the vaccine for measles has resulted in the aversion of over 60 million deaths since just 2000. And tetanus, newborn deaths due to the disease, have decreased 97%. And when you have measles and rubella, you're talking about kids who not only if they, there's a lot of death, but a lot of these little kids are going to have limbs and digits amputated. That's what measles does when it goes untreated. So it's as if we're not only not making as much progress. I think that the thing you would say about the EU is that they just haven't made as much progress as other nations. China's kind of eaten their lunch. If you look at economic growth, it hasn't come of China. It hasn't come at the cost of the U.S. The U.S. still has the same number of unicorns, the same number of billionaires as a proportion of the rest of the world. It's come at the expense of the EU. And the primary culprit in the EU is that they haven't grown. We've decided, we're not only not going to grow, we're going to regress. We're going to move backwards in time. We're going to have economic policies of 100 years ago, and we're going to take all the incredible advances in medicine that save lives, and we're going to roll them back. I can't think of the analogy here is Stalin put in place a bunch of cronies, not experts. And then one of the experts he put in place was some military expert or a general or something. And he put him in charge of agriculture, which is a big job in a food-based economy at the time. I don't think it was an energy-based economy. It was an agri-economy. And he decided, the best way to double productivity was to plant seeds twice as close to each other, despite the fact that that just doesn't work and actually ends up hurting crops and resulted in a famine that killed tens of millions of people. And that's where I think we are now, is we've just said, don't trust experts, trust your gut, trust your opinion. And this is such a fraying of our society, because it used to be we had political arguments. And then when the data came in, or a doctor, an actual expert came in and said, no, this vaccine is safe, we all rallied around that. And what was interesting with vaccines is the anti-vaccine movement started on the far left back in the kind of 70s and 80s. Don't put anything in your body, free to be you and me, just eat granola. And then the far right embraced it. And I think a tell for a really, really shitty idea is what I call the 40 test. And at negative 40 Celsius and Fahrenheit meet, creating an inhospitable environment. Whenever the far left and the far right come together on something, it's usually a really bad idea. But I think RFK Jr. will likely go down as probably, in terms of death, disease, and disability, one of the most damaging figures of this millennium.
I've been watching Senator Bill Cassidy from Louisiana, having a live meltdown on social media. He's fighting with anti-vax wackos about, how good the Hep B vaccine is. When I say anti-vax wackos, I'm also including Rand Paul in this. He's fighting with Rand Paul about maternal health care. And I thought, in preparation for today, I was going to check out, who of the Republican caucus or doctors before they came into public service. Roger Marshall from Kansas, who has sane moments, like where he's defended USAID and said, we're not just going to go and burn tons of food. You have to get it out there. He was an OBGYN that's proudly delivered over 5,000 babies. I'm like, you're part of the party that has stripped millions of women of reproductive health care, and you're an OBGYN? Like, I get it, you're pro-life, but these things, they do not add up. John Barroso, Yale-educated, an orthopedic surgeon, standing by and voting for this. And then Bill Cassidy, who was really kind of like the deciding holdout in terms of RFK Jr. getting through. And he said that he got, all of these promises from him and that the vaccine panel is going to meet. That never happened, right? The CDC directors, they're saying we never briefed RFK Jr. on anything. But I'm looking through what he used to do. The guy ran a hospital for the uninsured, making sure that 36,000 Greater Baton Rouge area children are vaccinated against Hep B at no cost to the school or the parents. Can you think of anything that is less commensurate with the modern GOP than who Bill Cassidy was before Donald Trump, or Donald Trump even 2.0? And then I was thinking back, like, this guy also voted to convict for the second impeachment, right? He was one of only a few that stood up and said, no, Donald Trump actually did incite an insurrection. I'm not going to leave this for the courts like Mitch McConnell. I'm going to say right here, right now, that he's guilty of this. So you could take a stand like that against a vengeful president who's definitely coming for you. But you can't say, as a doctor that has treated thousands of children and protected them from the thing that RFK Jr. abhors the most in the world, that you can't support his candidacy. And a colleague of mine mentioned this during the confirmation hearings for RFK Jr., and I thought it made so much sense. And I was like, why didn't they do this? You could have just given him a role at the Department of Agriculture. Right. You could have said the MAHA movement is foundationally about getting the dyes out of our foods and pesticides. And let's just put you over here. I'm not even saying that you have to make him the head of the USDA, but just, you rope him along. You got his voters, right? He was out there campaigning for you, talking about how bad the Democrats are. Put him somewhere where he can focus on the least frightening aspects of his ideology. They've given him license to tear down something that is so foundational to the safety of Americans. You have to go back to the pandemic and think about how the country was managed during that period to understand how the pendulum swung so far to the right so quickly. In June of 2020, over 1,000 healthcare professionals signed this letter saying, I know there are stay-at-home orders, but if you were out protesting for social justice, Black Lives Matter, after the murder of George Floyd, that is medically okay for you to be doing. And it ends by saying this should not be confused with a permissive stance on all gatherings, particularly protests against stay-at-home orders. And it was so interesting to me to see that coming up over and over and over again in my feed. And it feels like it was that kind of, the match, right, that they threw on this tinderbox that exploded into people going in all sorts of frightening directions when there was an inconsistency about what they were allowed to do during COVID. And, you said what the Democrats can be doing, and we can't be the party of the status quo. You can't say it's all perfect, but it feels like for so many people, there just hasn't been a proper accounting of how various blue states, and I mean, there were complaints about some red states like in Ohio as well, but were managed during the pandemic, and that the CDC has become the redheaded stepchild of all of this, that everyone just takes all of their fury and throws it at them. Like they say the CDC is who kept the schools closed. That's not true. I mean, Jared Polis, the blue state governor, opened up Colorado when he thought it was safe, and everyone went about their business.
It's really interesting. I think COVID, maybe with the exception of World War II, will be seen as probably the biggest influence, maybe in the last 100 years, in terms of how it changed our relationship with work, how it changed our relationship with the economy. The deficits exploded. Also, a lack of trust in government. But what's interesting is I think the CDC and you pointed this out, Trump deserves real credit around Operation Warp Speed. The Chinese and the Russians all announced vaccines. No one was lining up for Chinese or Russian vaccines. And when a devastating global pandemic challenge faced the world, who kind of, if you will, came to the rescue and said, all right, who's the smartest kid in class? We've got to try and defuse this bomb. Who is the smartest kid in class from a standing start? Granted, we had more resources, but who knows? It could have been someone, out of Japan or whatever. It was definitely the U.S. Where they really screwed up was in their communications and messaging. I remember a lot of medical professionals saying, don't wear a mask, don't hoard them, they don't work in the beginning. And then all of a sudden it was like, just kidding, you have to mask. And then what I didn't realize, and I think a lot of us didn't realize, is just the impact having closed schools had on kids and their families when they weren't allowed to socialize with other children. The people with money and adults could be fine, but kids kept out of school, put huge strain on low and middle income families. And the kids, and I saw this with my youngest really struggled, and we didn't know what was going on. It was just kind of obvious was not in school with device addiction, and just things kind of never have kind of come back. And then the other big messaging gaffe was the government gave people the impression that the vaccine would cure it and you wouldn't get it. No. That was the wrong messaging. The right messaging was the truth, and still very powerful, that if you take the vaccine, almost nobody dies. And that is, okay, we can't stop you from getting COVID, but we can mostly stop you from dying from it. And also, I don't think they did a very good job of countering some of the misinformation or the both-sidism around, well, there are some side effects, flip a coin. But more than anything, I really think the teachers' unions really fucked up here. I think they saw it as an opportunity to use these kids as drug mules and use it as leverage to negotiate greater compensation for a workforce which is primarily younger, primarily female, who are the least vulnerable, and weaponize that to try and get them time off and try and get them additional compensation. I think this was a real disservice. They did not step up. As a matter of fact, I think they exploited the situation. And I think so many people were so traumatized by the whole thing. I would argue, like, who handled it better than the U.S.? Yet it has created this undercurrent of mistrust in our system, in our government, in science, and expertise. It'll be really interesting to kind of say, well, what would we, if this happens again? One, it's going to be devastating because we seem to be dismantling the health apparatus. But what would we do differently around messaging?
It'll be hard because it doesn't look like we're going to have reliable messengers, or in general, we don't have a national figurehead that everybody trusts and can get behind. And so, Trump obviously did his whole injecting bleach, but Trump did a lot of things that are not cool. Remember those shots of Deborah Birx and Anthony Fauci with their head in their hands, like, oh my God, I can't believe this is happening. Not, again, to detract from Operation Warp Speed, which was this huge achievement.
Yeah, the private sector is responding to some of this, I guess the adjacent of the anti-science, anti-vaccine movement is with this. And I think it kind of a giant distraction that's rooted in good ideas, but is, in my opinion, another weapon of mass distraction, is the Make America Healthy Again, the MAHA movement. And a lot of large food manufacturers are doing a lot of what I call signaling in response to RFK's MAHA movement. Coca-Cola is rolling out a cane sugar product as an alternate to the high fructose corn syrup sweetened sodas that are available now. Okay, fine. And there is, I think, a very strong argument that a lot of our economic incentives and regulatory capture have created a food supply system that is just not optimized for health. It's optimized for profits. That's the bottom line. And we subsidize foods that are just not good for you. And meanwhile, the foods that are good for you have become increasingly expensive. Starbucks may eliminate canola oil from their menu. Steak and Shake will cook its fries in beef tallow instead of seed oils. General Mills, PepsiCo, ConAgra, Nestle, Hershey, and Kraft Heinz have all pledged to eliminate artificial dyes from their products in the next 2 years. Like, I think he gets some of this right, but again, it's a bit of a distraction because, and I've been on this for a while, if you wanted to make America healthy again, I think the two things you could do would be, one, increase minimum wage to $25 an hour, make sure that no one goes hungry, and also, and this is less conventional, make GLP-1 drugs accessible and free. The obesity industrial complex has been weaponized, and you are fat shaming people if you talk about it and don't acknowledge that they're not finding diabetes, they're finding their truth. $1.5 trillion goes to obesity related illnesses. 70% of America's overweight or obese, 40% are obese. In Japan, it's 4%. And there's just so much money in this business and so many subsidies, subsidizing really shitty food, that you have essentially Washington fighting to make us less healthy and not reinvesting that money and making kids more healthy, such that they don't need or don't feel a need to get cheap calories from fast food that is bad for them, such that they don't have to head out in COVID driving their Uber with a Diet Cokes and their diabetes medication, putting themselves in harm's way. This would, in my sense, they're talking about within the system, they're about ideas, but it's the system within which we operate. That if people can't afford not to have a second job and are constantly stressed out and they can't afford to eat healthy, they have to just get the cheapest calories possible. That is the system. That's the basis for health. And where it shows up is the people in the highest quintile or the highest decile of income live on average 7 to 10 years longer than the poorest Americans.